Therapists of Reddit, what made you realize you were treating a sociopath? I've worked with a few. The most disturbing one was an ex-military guy. He had served time in Iraq in the early 2000s, and he had killed in the line of duty. He always seemed a bit off, but the story he told me that was like, holy fuck, he's a sociopath, was when he told me about how he would do things like kill goats, because he could get away with that, and some families there depend on livestock to survive. He also told me about making starving children fight over candy. He talked about watching kids fight to the death with rocks over candy he would throw on the ground. Awful, scary stuff. This person is currently a free man. The second was more of a stereotypical sociopath. He had been arrested for drug possession, and during the arrest attempt had stabbed himself a few times while trying to stab the arresting officers. He was very sharp, but intentionally chose the life of a drug dealer because it was violent. I don't think he ever actually killed anyone, but he definitely abused people pretty horrifically. He dealt meth and enjoyed power tripping off messing with desperate addicts. He would make them do gross, painful, awful things to earn their fix. He was also the only antisocial person I've ever met who had a weakened pain response. He once stabbed himself with a pen to prove to me he didn't feel pain. And I mean like a legit, buried the pen in his flesh, blood everywhere kinda stab. Yeah. Not a therapist, school psychologist. When talking to a student, he casually mentions how he keeps his parents in line by threatening to call ICE to have his mother, undocumented, deported. He doesn't care about his family in the least, and they have zero control over him. His 2 siblings are typically developed and are terrified of him. Now that you mention being Hispanic, I know some illegals. It seems like their kids threatening to call ICE is quite common among teenagers going through their rebellious phase. I've heard a bunch of stories like these. I guess it's a great threat provided they don't call your bluff, since there's absolutely no leverage on the side of the parents. Psychologist who works in a correctional setting here. Yes, I agree with the people who commented regarding Diagnostic and Statistical Manual 5 criteria for antisocial personality disorder. I've seen a lot of those. In regard to personal experience, the people that make my stomach turn are the unrepentant sex offenders. I think many sex offenders suffer from a treatable, albeit gross, disease. But I've met many who try to justify what they did, it happened to me. Rationalize it, it's legal in other countries, and flat out blame the victim. X's parents should have taught him or her better. I won't debate these people, and I typically redirect since there's not getting through to people like that. I also learn I've worked with a sociopath when I figure out I got hoodwinked after the fact. Like an inmate has left my office and I think, oh, what a nice guy, and find out what he's really like from other inmates or staff. Sex offenders are like vampires. They have to starve themselves for the good of the people, and you can't trust someone to starve themselves for strangers. Especially when you consider that people will hate them regardless of their sacrifice or not. Great kid during the day, tortured his foster siblings and videotaped it at night. Loved being the good kid in the house during the day and didn't understand why Jimmy would scream and hit so much. Meanwhile, Jimmy was his target at night but wasn't verbal and couldn't tell anyone. Sociopath was always kind to the verbal child, so only Jimmy was prey. In front of the foster parents, Sociopath seemed like a model teen. Finally, a video surfaced through sheer dumb luck and now Sociopath is in jail. No one believed it until they saw the video. He's handsome, charming, and will ruin lives because his youthful offender status means he won't have a criminal record. Tip: if someone puts themselves in a victim role, run. They want you to save them. When someone is genuinely overcoming trauma, it doesn't look like that. I am positive that Sociopath will use his foster care history to seem vulnerable and pull in a woman to torment and manipulate. Not a therapist, but was counseling a student. The student was female, 15, smart, had a good amount of friends, and liked cutesy things. Here's some things she said to me that made me suspect something was really wrong with her. Keep in mind that I have no qualifications to diagnose someone. I just think she's abnormal. Was dating a boy. Told me she had no feelings for him, but was dating him because he was useful and did things for her. She did nothing in return for him, and he was very sad about it. When I asked her if she felt bad for making him sad, she told me, no. If I make him sad, that's his problem. Why do I have to care about his feelings? I can't feel what he feels. It doesn't affect me. When I asked her if she felt guilty for using him, she said, no, he started hanging around me because he likes me. If he likes me, then he should make himself useful to me. What else is he good for? She had no concept of romantic affection, But that may have been excusable for a 15-year-old depending on maturity. She told me her friend's dog had died and she pretended to care because that's what she was supposed to do, but it was her friend's problem and she didn't understand why she was supposed to feel anything about the situation. She told me that one of her teachers had told her friend to stay away from her because the teacher noticed that her facial expressions often seemed faked and forced. She did not understand why this was an issue and asked me, "Doesn't everyone fake emotional reactions? Like, if someone tells a joke, don't you pretend to laugh? Or if someone tells you someone died, don't you pretend to feel sorry for them?" She asked me to explain to her what genuine emotion felt like, and what empathy felt like. After both explanations, she was completely confused and told me that she had no idea what I was describing and had never even suspected that everyone around her wasn't faking emotion and empathy just like she was. She left the conversation convinced that she was normal, and everyone else was just weird. Edit, forgot to add that multiple people she knew had confronted her about being a sociopath, and that she admitted that she had no long-lasting friendships since everyone eventually left. She said this didn't concern her since she felt no attachment to anyone and only kept people around because it made life easier for her. She was also very caught up in her image, particularly her speech. She was careful to use slang and a cutesy tone of voice when speaking to adults and peers because she said, "I'm only 15, it would be weird if I didn't talk like a 15-year-old. Everyone else speaks this way so I do too. I'm young, I have to act young." Psych nurse here. Patient I gained a lot of trust with told me about this person he and 2 others tortured almost to death. I knew the case because it made the news. He went to jail for it. Went into details about the torture. It included making hundreds of cuts to the person's body and giving them an acidic bath. Anyways, his story is that this person raped the neighborhood girl with Down syndrome and it was a payback. This guy was in our ward for about a month, continually threatening to end his life if he was discharged. After weeks of knowing him and gaining some form of trust with me, he ended up admitting to me that he had made up the lie about the grape because he simply didn't like this guy because of an argument, probably drug-related, years back. TLDR, patient lied about a grape so he could convince his friends to abduct and torture a man that he had some petty disagreement. Thing is, he stood trial as a minor and threw his mates under, claiming they were the instigators and he simply went along with it. They are still in jail. Holy shit, I'm reasonably sure I know the same person, in West Tennessee? Nope. I don't live in America. I've been a licensed therapist for going on 3 years now, but I've been seeing clients, with an intern license, for about 5 years. The vast majority of my clients have been on probation or parole and have had a wide range of mental illnesses, including antisocial personality disorder, ASPD. My mentor described folks with ASPD like this: it's in the eyes. They've got shark eyes, cold and predatory, like they're staring right through you, looking for your weaknesses to exploit. And, having worked with several people with that diagnosis, and adolescent precursor conduct disorder, it's pretty damn accurate. People with ASPD are some of the most manipulative people around, and many of them enjoy it. Manipulating people is almost a game to them. Well, a mini-game to indulge in while they work on whatever else they're planning, even if it's as simple as, present as normal. And, let me tell you, they're good at it. It's incredibly difficult to outplay someone with the diagnosis at their own game because they've been playing it their entire lives. Since my clientele are court-ordered, most of the manipulation revolves around trying to cover up whatever else they're doing, abusing their domestic partner, abusing substances, etc. Some are more impulsive than others with the diagnosis, but they all have the shark eyes. Edit, I've gotten a couple of comments about this post being irresponsible and or stigmatizing to folks with mental illness. First, let me be very clear, this is, in no way, a diagnostic indicator of antisocial personality disorder. I do not just look someone in the eyes and magically know that they've got the disorder. I utilize a diagnostic questionnaire based on the Diagnostic and Statistical Manual of Mental Disorders 5 criteria for said disorder and compare it to the case history I've been provided by previous treatment providers as well as from probation or parole. My dad's a now semi-retired psychologist. Back in the 90s, he was working as the director of psychology for a large housing and treatment facility for the severely mentally disabled. He wanted to get into doing some therapy sessions for non-disabled folks on the side, just to mix things up and stretch his professional wings a little. Our house had a home office wing with a separate entrance, so he decided to start seeing a few patients on the weekends. This plan lasted about 3 weeks before he realized that he'd made a terrible mistake. One of his patients, a very large gentleman, began visibly melting down during a session, pacing around the office and acting increasingly erratic. My dad's thoughts turned to the fact that his wife and 3 kids were now in the same house with a big dude who was clearly unstable. He slowly positioned himself by the door in case the guy tried to bolt for it. The guy noticed this, pulled out a gun, and said, "Don't worry, if I wanted to hurt you or myself, I would have already used this by now." My dad utilized the same skills that he knew from working with violent patients at his main job to talk the guy into putting the gun away. He escorted him from the premises, and never saw another patient at home again. My mom was pissed. Most counselors are extremely careful about giving details about their personal life for this very reason. One minute you say you're Greek Orthodox, next minute a mental patient is sitting next to you at church. But to run psychotherapy out of your home is just plain dangerous. Some counselors won't even give out their last name for this reason. Yeah, it was dumb. I think he made the mistake because his background wasn't really in psychotherapy to begin with. His specialty, which he still does consulting work in, and co-wrote books on, has always been in managing extremely mentally disabled patients. Not a therapist, but I did a lot of work with young guys as a mentor in my military career. Had a guy who wanted to talk to chaps, I asked him why. He then went into graphic detail about how he had been raping women. The kicker was he wasn't going in to confess or because he felt guilty. He wanted chaps to get him into the psych clinic because that was where his girlfriend was. So, then you reported him, right? Yes, he was branded, but that didn't really matter because a few days later he drank 2 bottles of cough syrup and tried to attack another chaplain who was giving a speech about self-control. Licensed marriage and family therapist. I've seen it mentioned that sociopaths don't come in for services, and this is true, but I've seen some incredibly sociopathic behavior. It primarily comes up with husbands I see. Men who were raised to think that their household was their kingdom and everyone in it was there to serve them. Men who can't comprehend that their wives or children have their own thoughts and feelings. It takes about 10 minutes to tell the difference between an angry spouse that doesn't know how to communicate and a person who genuinely has no ability or will to empathize with their partner. Best example was after this guy's wife had broken down crying in our 3rd session about how he talked down to her. I asked them both what some goals for therapy might be. His immediate response was, "I want to work on understanding why my wife makes such stupid fucking decisions." She broke down crying again and ran out of the room. The guy just looked at me like, "Women, am I right?" He had no idea that what he said was hurtful, or he wanted to hurt her. Either way, it was chilling to watch. Spoiler alert, she left him 2 weeks later after he threatened to shoot her if she left him. Yes, she's safe and much better now. Are you sure that guy was a sociopath and not just a massive asshole? Oh, he definitely wasn't a true sociopath, just saying he had some very sociopathic behaviors who could do some cruel emotionless things. This sounds like my boyfriend to a T. I've even considered getting in contact with his exes because I have this idea that he only has ever been like this with me, but that might end very badly. I'm leaving him. He's working night shifts, and I'm scared to fall asleep because I'm using my laptop as an alarm clock and he's threatening to break it / smash it. He broke my old laptop, a tablet, texted all my friends, etc. So, I work 9 hours, have to be up in the morning early to shop for work uniform and look at a new place and then go to work again. It's midnight. I'm fucked. Therapist here. I've had several clients that were a bit extra. The one that sticks out the most was during my work as an inpatient therapist where a BPD, HIV positive, sex addicted client tried locking me in her room during rounds and offering favors. Followed by a barrage of comments after being rejected. I haven't done therapy in 2 months now and I think I'll stick to academia for now. This isn't exactly what you were asking, but a relative of mine was given an unofficial diagnosis of antisocial personality disorder when she was younger. At the time, the doctors told her family that they didn't like to officially diagnose someone that was under 18. As a child, she was extremely manipulative and could go from acting very normal to being stone cold in the space of a moment. Her parents forced her to go to therapy, but as soon as she became an adult, she stopped. Her life now, as an adult, is pretty normal. She is still extremely manipulative but is also better at hiding it, so she comes off as charming. She works a normal job, though she usually changes jobs, by her own decision, every year or 2. Her boyfriends seem to only last as long as they are useful for whatever reason. I don't think she really has friends though. That type of thing always fucked with me. For background, my mother is a covert narcissist and my aunt, her sister, is a typical narcissist. My father is just a selfish deadbeat that has only helped raise one of his 11 kids, not me or my sister. So me and my siblings are all pretty fucked up one way or another. Also, the rest of my family are also heavily fucked up and are the definition of a toxic family. After being gaslighted by all the adults in my life, I have severe doubts of my own perception and simply don't trust my sanity half of the time. So when I talk to a therapist about my upbringing, I always have this voice in the back of my head telling me, I am really the problem, and I am a liar. What are the odds that everyone else is so fucked up? You sound like the actual narcissist. This post just fucked with me a bit because that is more fuel for my personal demon, the child of an orgy between low self-esteem, depression and anxiety. I used to work in a group home for little kids, under 12, with severe behavior problems and psychiatric issues, as a floor staff while I was in college. Several of those kiddos had diagnoses of antisocial personality disorder, but I was always skeptical because that's a hell of a label to give to a little kid. And then I met AP, not his real initials. This child was 6 years old, and beautiful. He was perfectly behaved, but many of our residents had a honeymoon period of great and normal behavior for a couple weeks after intake, so we were just waiting for him to show his true colors, behavior-wise. His honeymoon period lasted 8 months. None of the staff knew why this kid was there. His dad wasn't in the picture and mom was serving time, and foster care wasn't working out, which is why we had him, but we didn't have any issues with him at all during those 8 months. He was a perfect little boy. Then one day, he wasn't. I took the kids outside to ride bikes, and the second he was out the door, he ran to the backyard, grabbed a kitten, and crushed its head. The boys' bedrooms were in the basement of the house. They had windows that were on the ground level outside, and he had seen the nest of kittens from his window. I was horrified, obviously, and brought all the kids inside. He calmly told our facilities manager that he had no idea what I was talking about, and looked so confused that the manager questioned me, and I had to go get the dead cat. I was visibly upset, and AP just looked at me and grinned. That was the first oh shit moment of several. AP would instigate aggressive behavior to initiate a restraint. Once in a restraint, our procedure was to hold the child for 30 minutes. If they weren't calm at that point, the on-call nurse would give a booty dart, shot of Benadryl, to calm the kid down. AP loved needles and offhandedly mentioned once that it was his goal to get 1 shot a day. In another incident, 2 staff had to escort AP into a secluded area because he was being very violent. During the transport, something happened. I think the metal door shut on him, and AP cut his foot substantially. We went to get the nurse, and when she came to help him he was laughing, digging at his cut to make it bleed more, and writing on the wall with the blood. Most of our kiddos were wards of the state, but AP's grandparents actually came and visited him. The other kids would be so jealous, but AP would, quite convincingly, act like he didn't know his grandparents, and then later he would taunt the others who never had visitors. When I left that job, he gave me a picture he drew of me. It was a typical little kid picture, but there was an X over the mouth and the eyes were scribbled out. I asked him why he drew me that way, and he said, "You don't deserve eyes because I don't like it when you see me. You don't deserve a mouth because you say things I don't like." Edit, found the picture. I still work with kids with severe behavior problems, psychiatric issues, and severe disabilities. I love them. I have worked with hundreds during my career. I still think about AP. Soon after I left, they transferred him, at 7 years old now, to a more restrictive environment, and the last I heard he was the facility's success story. Mom got clean and he's back home with her, a perfect angel, and he even comes back to the group home to give motivational talks to the other kids on how to behave. I truly hope that's true and his treatment was successful. But that was one scary little kid, and I doubt it. Edited to add, I am not trying to vilify this kiddo in any way. He was very young and in long-term inpatient residential care. Scary isn't the right word, he was obviously very sick. He stands out in my mind as an example of how much work needs to be done in the field regarding effective interventions and basic awareness and understanding. Can someone like that actually be rehabilitated? Is it realistic to worry that that disturbed child is still inside waiting for a trigger? How certain can we be that someone is rehabilitated and their life won't become the premise for a horror movie? I really hope he was. But it would not surprise me a bit if his rehabilitation was just him learning to manipulate people better. His mama was a heavy meth user while pregnant, and I often wonder if that was a factor. He wasn't intellectually disabled or anything. He will probably always haunt me because he's the only kiddo I've encountered that I couldn't reach in some way.